Everybody is looking for a solution to hair loss. Let's explore how hair transplants can help. How do hair transplants actually happen? Well, it all starts with a little magic called follicular unit extraction, or FUE. Don't worry, that's just a fancy term for taking tiny groups of hair from the back of your head and moving them to where you need more. Medical team uses a small tool to carefully remove hair follicles from the back of your head. This area is called donor zone. Donor material is the hair that's resistant to falling out. Next, the doctor makes tiny holes for the future hair. We call them channels. After channel opening is finished, the hair will be placed into them. It is a little bit like a gardening, but for your head, the medical team places each follicle unit in the hole. After hair transplant is done, it is important to note that it can take several months for the new hair to fully grow in. But once it does, you'll have a fuller, natural-looking head of hair. And there you have it. The science behind hair transplants is pretty fascinating, right? Remember, always consult with a professional to see if it's the right option for you. Thanks for watching. Hit the like button if you found this helpful and follow us for more cool science facts about hair care.